The United Nations says millions of people in Pakistan are without access to medical care following devastating floods. Hundreds of healthcare facilities have been damaged or destroyed after heavy rains submerged up to a third of the country. The floods have led to more than 1,000 deaths and triggered a major humanitarian crisis, with survivors at risk of disease and malnutrition.
Rifat Khan scans the soaked ruins of her home. The mother of 9 daughters lives in northern Pakistan's Swat district. For weeks, it has rained here non-stop. The water flooded their home, almost completely destroying it. People ask me what I've lost, but it's impossible to even guess. Our whole house has been destroyed. There's nothing left. Nothing at all is left in this house. Pakistan's monsoon season began in June. Experts say that there has been 4 to 5 times the normal amount of rain this year, turning rivers into raging torrents. The floodwaters reached the home of Rifat Khan and her daughter Bushra a few days ago. We were just about to pack our bags when the water came. It rose very quickly, up to our necks. We left our bags behind and climbed up onto the roof to save our lives. More than 30 million people have been affected by the flooding, with damages estimated at more than $10 billion. Food, water, and shelter in particular are in short supply. Pakistan's Prime Minister Shehbaz Sharif has promised immediate aid.
Every penny will be spent in a very transparent fashion. Every penny will reach the needy. There will be no waste at all.
As the cleanup work begins, disease is spreading throughout the areas affected by the flooding. There's also a shortage of medicine, including in Swat district. I don't have enough money to go to the doctor or buy medicine. We have sore throats and we're getting heat rashes on our skin. Her daughter Bushra was about to get married. Rifat Khan had spent months making new garments in preparation for the wedding, all destroyed by the flooding. She doesn't know where to turn to. We're totally helpless. My daughter and I are suffering badly. I can't cope with the severe consequences of the flood. I just don't know how we'll get through this. For now, Rifat Khan and her daughter are staying with friends, but they have no idea what their future holds.
We can talk now to Arif Jawad Khan. He's the Pakistan Country Director for NGO Water Aid and is in the flooded area in Sindh province. Is that much needed aid finally trickling through to those who've been completely cut off for days now?
I think the scale of the response is much smaller than what is needed on the ground. And I think that's what we are faced with. In fact, one of the things I want to mention is that besides being a flood and climate change disaster, this is also converting into a disaster related to displacements, because hundreds and hundreds of thousands of people are actually on the move. And also a public health disaster, because as you were also reporting, malaria, diarrhea diseases are going up. I talked to health officials and those who are providing assistance, including our own partners, because we've started our response as well in 3 provinces, that the number of diseases are going up. And to the extent that in one district, a health official was saying that they can't even cope with the number of malaria patients that are coming to them. So I think the scale of the response is currently much, much smaller than what is actually needed on the ground.
But how do you get through to those people who really do need it, those who are completely cut off, with bridges, infrastructure, roads completely destroyed?
Yeah, there are actually, there are 2 kinds of people. One who have actually stayed in their homes, but as I said, hundreds of thousands have actually moved out. And, a number of them, I saw actually, tents upon tents, tented cities almost close to Hyderabad, which is the second largest city of the province. And then so they are actually congregating in the cities or next to the cities and occupying whatever building or space they can find. So I think it'll take a while for this to settle down in terms of organizing the response. I think the first phase is about organizing the response, identifying places for those who can go somewhere and then providing response within those places. We are already trying to reach those who are marooned, who are within their communities, and also those who have been displaced to near their homes. So it is a challenge. You are absolutely right. It is a challenge, but I think we have enough experience now. Pakistan, this is not the first time we've had this disaster. I think the capacity to implement is there as long as the international community continues to support at least the level at which the response is needed right now.
Would you say the worst is over? Do we have some sort of end in sight?
No, I think it's the beginning of the worst, because the diseases actually start spreading, a few days after water has receded, because then, whatever water is left behind gets contaminated, and then all the water sources are contaminated. People start drinking from that sometimes, and then that actually spreads cholera, diarrhea. And as I said, malaria is already. So I don't think, it's just the beginning of actually, another wave of crisis, which will be related to health and also providing the basic services to these people who've been either displaced or are living in villages which are still underwater.
Arif Jabbar Khan, Pakistan Country Director for NGO WaterAid. Thank you very much for the insight.
Thank you for having me.